Welcome to the Healthspark, igniting healthcare management change and evolution. I'm your host, Dr. Raya.
Hi, I'm Dr. Raya, and today on the Healthspark, we've got Beth Raboin from Global Medical Virtual Assistants. Thanks so much, Beth, for joining us. Welcome.
Yeah, thank you so much. I'm so excited I could be here today.
So are we. So I'm going to start by reading your extensive bio. So I'm going to try to kind of go through it quickly. So Beth Raboin is leading Global Medical Virtual Assistants. We'll refer to it as GMVA going forward. In vision and the day-to-day business operations, securing the functionality of the business to drive extensive and sustainable growth, combining her strong leadership and determination with over 22 years of corporate experience in the private and public sector of surgical device, pharmaceutical, and specialty pharmacy industries. She's keeping the company moving forward with high-level strategy while understanding the details of the day-to-day execution to ensure steadfast success. Previous to Beth's corporate and entrepreneur experience, she competed as a full athletic scholarship athlete as a Division I gymnast at the University of Florida, where she graduated with a Bachelor of Science at the College of Health and Human Performance in Health Science. That's so cool. Welcome.
Yeah, thank you so much. I always have to say, shout out, go Gators.
Right, that's so cool. So welcome again, Beth. And I just want to always start with asking our guests for you to tell us a little bit about your story, your journey, both personally and professionally. So tell us a little bit about yourself.
Yeah, so my journey has not been a straight line. Like a lot of us, you kind of tic-tac-toe and find where you really where you wanted to end up, right? I originally as early as high school knew I wanted to be in medicine. I wanted to be in the operating room. That's where I always wanted to be. And so in high school, I was lucky enough to have a vocational program that had the the CNA program to be a certified nursing assistant. So I did that program to be able to learn all the different possibilities within the healthcare system of where I might want to land. The operating room was it. That's really where I wanted to be. So from there, I ended up at University of Florida on a full scholarship for gymnastics. And as I was training, clinical hours were going to be we're going to be at the same time as practice hours. And so my coach had said, hey, well, you've got to choose. You're here on a full scholarship to be an athlete, or you can change, you can maintain that and change your major, or good. So I decided, oh my God, yes, of course, I'm here. I changed my major. I ended up because I had all the prerequisites, I could very easily just slide over into community health, school health, and decided to make the shift. And I figured I'll go back to school after. I'll be a PA. I'll go back. I'll be an APRN. I'll figure it out. And so once I launched into the real world, I ended up in pharmaceutical sales and I loved it. And I was making more money than a PA would. So I'm like, well, why would I go back to school? This is fantastic. So I ended up finding my way into the OR after all, doing surgical devices. And so I wasn't at the table, with my hands deep in a patient, but at least I was there in the room. I was able to really be involved with patient care, which is exactly where I wanted to be. Fast forward after many years, in the corporate piece of that, I started medical virtual assistants. And so it came the birth of GMVA, which has been such an incredible ride for me personally. But also just I can't even begin to tell you how it's transformed my life from being within the corporate world to then being an entrepreneur, but also really being able to still stay in healthcare, and patient care is still my number one focus. So it's been exciting. We started with one small practice doing one particular task. I paid close attention while I was a CNA and then while I was in surgical devices and pharmaceutical sales of what's happening in a medical practice. What's the flow of the patient journey? What's the flow of the practice? How are the administrative tasks getting done? Who's getting those those done. So I learned all of that because I paid close attention. And so I knew how to do insurance verifications. I knew how to do prior auths. I knew what happened at the front desk. I had an understanding of consent forms and getting insurance verifications done and beyond, right? So I knew how to do those things. And so I figured once I jumped into this space, I knew that we would make a really big impact in the healthcare space because there's such a need for additional administrative patient caretakers to really do a lot of the back end work. And so that's where we fit in, and that's where my journey brings me.
All right, awesome. So I want to talk about more about that work at GMVA because I think when you hear the word medical virtual assistant,
Hmm.
people get confused and they're like, what does that mean? Like, how do you take vitals as a, and so break that down for us. Like what
Sure.
exactly, describe the work that you're doing at GMVA and what does that entail? And you just kind of, you talk about it, but break it down for us.
Sure. So with any medical practice and or hospital or hospital system, there is of course the physician, there is the nursing staff and the mid-level practitioners, but then there's all of the support structure and support people around those people that are not clinical. They're not in the clinical aspect, they're the administrative. That's where we fall in. That's where we really do the work. So we are everything and anything from what like a front desk person would do, but we would do it remotely. Then everything on the back end with insurance verifications, prior authorizations, we can also do all of that and the heavy lifting that goes in with those pieces of the work. Then there's everything in revenue cycle management and denied claims and resubmittal of claims and charge entry and beyond. And then, patient balances and following up on that. So all the administrative work that goes around patient care, that's really where we set ourselves apart, and we really are part of that journey.
Excellent. And I find that, so in my prior life, when I was managing ambulatory offices, what
Yeah.
I found and that I love about the work that you all are doing is that inevitably what would happen with that front desk staff is that you would have people covering the phones, or you would have people working on denials. But if somebody called in sick in that doctor's office, they would pull people, right? And so, yeah, maybe you were working on denials, but if somebody called out in the front, that person would get pulled to come cover the front. And so in my mind, I envisioned that GMVA is perfect to have in that environment because you still have your core team that maybe they're working on a few things, but if somebody calls out sick, you've got GMVA kind of, working all your denials so that the staff can actually take care of the needs that are immediate in that clinic, and that you all can kind of take care of those best practices and help to save on that administrative burden.
Yeah, absolutely. Whether that's cross-training us to do different roles within the practice, or it really is a matter of maybe just your practice or your ambulatory center, for example, has scaled so large that there's really only space for 2 receptionists at the front, but you really need 4. And so that's where we can be brought in as additional team members to really support the existing team that's within the practice.
Beautiful. Okay, beautiful.
Yeah.
Okay, so tell me what feels most meaningful or energizing about the impact that you're creating in healthcare. And I also have a lot of thoughts because my concern, especially being in healthcare for so long, is that I'm very worried about these like smaller physician-owned practices that don't have these big healthcare systems surrounding them. So
Yeah.
tell me about what your experience has been of, based on how long you've been supporting these.
Yeah. Oh, I have so many, but I'll start with one of my absolute favorites. Time and time again, we are told that the existing staff within the practice couldn't imagine doing their daily life, their daily work without the added support of GMVA, of the VAs that are working directly with them. Morale is higher. We're really taking a lot of the excess work off of their plate so they can really focus on direct patient care. And that really is so that they can offer that white glove service still to those patients and really spend those extra few minutes instead of running out of the room and having to do some of the administrative work. That's the administrative burden that we can take over, that then therefore they can spend those few extra minutes with their patient. When someone comes to the front desk, I mean, everyone knows when you walk into a medical practice, there's the glass, right? The glass at that receptionist desk. That glass door should be open. They shouldn't just only be handling phone calls and then have to wait for to put a patient on hold to then talk to somebody right there that's standing there. They should have the ability to be able to immediately tend to a patient that's in front of them, and then we can handle everything that's coming in or happening at that same time. So that's probably one of my where I feel like I'm personally feel like I'm giving back, where people really enjoy where they're working and aren't getting burnt out. They want to remain where they are. They're enjoying their work even more, and they couldn't imagine doing it without our support. So that would be one of them. Another one is the patients that we are directly working with, they don't know that we're outside of the practice. They really view us as part of the team because we really are an extension of the practice. And so that is one of the more exciting pieces for me, because I feel like we're an amazing adjunct service added on to support the existing path of the patient, how things are functioning within the practice. And we really make a difference, and the patient isn't aware because we are part of that. And so that is another really exciting thing for me.
Awesome. Okay, great. And I didn't ask you, how long has GMVA been in business?
Yeah, we're going into our 7th year. So yeah, it's been, previous to COVID, I had just launched the company. And so, we started off small. The conversations and the sales process was very slow. The cycle was long to get a new practice to sign up because it was just so new. The thought of utilizing remote staff, especially in the healthcare space, was just not, it just wasn't recognized as an option. And then COVID happened, and it really forced the entire healthcare system to realize that, wow, not only can this be done, but it can be done extraordinarily well, and incredibly efficient, and in ways that people wouldn't even imagine or even think that they'd be open to imagining. And so with COVID, that really, really catapulted this whole industry to adopt the idea of utilizing remote services.
Amazing. Okay, great. All right, so let's move on to innovation. What innovations or philosophies inspire the way you design scalable, sustainable virtual assistant solutions for healthcare?
Yeah. Oh my gosh. Well, so we're considered technology, which is interesting, but we are really human capital. We are the additional bodies and helpful hands behind the scenes that are really part of the flow within the practice. So I think just overall, by the existence of our corporation, we're still new. This is still new. We haven't even scratched the surface of what the capabilities are in terms of our growth and scale, because frankly, it still isn't that highly adopted yet. There's still not that many practices or hospitals out there that have really decided to dive into the access and the use of medical virtual assistants. So I still feel like, even though we're human capital and we're not necessarily AI driven, or we're not tech driven in that aspect of software, we still are really relatively new, and still newly being utilized. So I think just by the virtue of being in the industry and doing what we're doing, we're still quite interesting and scalable, which is wonderful, because as practices adapt and adopt our services, they can grow and scale, and we can grow and scale with them.
And I imagine that after 7 years, you have a proven return on investment that you can demonstrate to, anyone new that's looking to invest in this, make this kind of investment.
Oh, absolutely. And we've ballooned to just up over 1,500 people in our organization in a very short period of time over the last 6 years. And a lot of that has been the consistent growth has been from our existing client base. So our medical practices that already adopted us as early adopters, they're still with us today. And they've continued to grow with us because they've seen, wow, we're not going to only use you for insurance verifications. We're now going to use you in prior authorizations. And then they start to use us in prior authorizations for medications. Then they're utilizing us in the back office with billing and everything within revenue cycle management. And so we've seen our growth with our existing client base. And there is there is no better compliment as a business owner than existing clients continuing to not only use our services, but expand with us. And that's really, I mean, that's just a true testament to the talent pool we have here.
Amazing. Okay. All right. So now let's move on to a more serious question.
Sure.
But with the US facing severe healthcare workforce shortages, crises, what do you see as the biggest threat to healthcare delivery, and how can virtual staffing play a role in addressing them?
Yeah. Well, interestingly enough, it's not the lack of physicians. We will see a lack of physicians in the near future, but it is not the lack of physicians. It's really the lack of the administrative people around patient care that are really dropping off fast and furious out of healthcare. And so with that, what we're going to see and the biggest threat to healthcare will be delayed service. A patient that really needs an MRI, a patient that really needs a hernia repair surgery, a patient that really needs to get in to see a physician for a lobectomy. I mean, those are the types of things that if we have a delay in healthcare, the United States will really, the landscape of what our health system will look like will drastically change in a way that we don't want to see it. And therefore, people that want to have a baby, they're 32 years old and still not getting pregnant on their own. And yet then there's delays to getting in to be able to even be assessed to know, okay, do I need to do IVF, or am I, or do I need to adopt or look at other ways of being able to build my family? I mean, all of those types of things will be delayed if we don't have the administrative workforce around patient care. And that will be one of the biggest threats to us.
Okay. All right, so let's move on to a bonus question. What's one piece of advice you'd give to healthcare leaders? And especially, I'm always very interested in giving advice to emerging healthcare leaders who are struggling to modernize their operations. What advice would you give them, especially if they're afraid to modernize their operations?
Sure. And there's so much modernization happening with AI, especially. There's so many new tools coming out. There's so many vendors that are saying, oh, we can build this for you. We can build that for you. And I can talk for miles and miles about that industry. But I'd have to say one of the things that I would, especially an emerging leader that's thinking, how do we evolve? Do we evolve? I think the first thing that they need to assess is, well, what is their practice going to look like 3 years from now? And start banking on how to make those changes and initiate those changes now for what you want the practice to look like in 3 years, or what it's going to look like in 3 years, regardless of what leadership decides to do. And so I would say then make decisions based on what you want that picture to look like, and also what it's going to be potentially forced to look like, and start evolving in that direction. There's no reason to throw large budget money towards something that you're not really sure is going to be really going to build the landscape of what your practice is going to look like 3 years from now. But imagine what you think it should look like and start building, whether it's software, teams, building out new lines, new lines of offerings. And kind of thinking in those terms, and then go in that direction.
I love it. So that was my last question, but thank you so much. I really appreciate you starting by telling us that your journey didn't start in a straight line. And I think that so many of, the students that I work with, the people that I coach, they think that the journey should start in a straight line. And I really appreciate you starting with that fact, that it doesn't have to be in a straight line for you to be successful. And I think that the success that you've had at GMVA already in 7 years really demonstrates that the beautiful career path that you've had and the success that you're having. So thank you so much for sharing that story with us.
Oh, thank you so much. I love that. Thanks.
Thanks so much, Beth, again, for your time. Thank you so much for sharing your time and your story on the Healthspark.
Loved it. Thank you so much for having me.
Thanks.
Thanks for listening to the Healthspark, Igniting Healthcare Management Change and Evolution. Please look out for future episodes and follow us on our social media pages.